All right, let's get into a topic that is absolutely fundamental to our patients' health, but is so often overlooked in day-to-day clinical practice: female intimate hygiene. As future doctors and healthcare providers, really digging into the science here is critical. So today, we're going to break down all the evidence from a gynecological point of view.
Okay, so here's our game plan. First, we'll talk about why this topic really needs more attention in the clinic. Then, we'll get into the science of the vulva's own natural protective systems. After that, we'll look at how hygiene needs change throughout a woman's life, cover the best evidence-based practices, and then we'll get into the common mistakes that we see. And we'll wrap up with our role as clinicians in educating our patients.
So first up, why do we need to have this conversation at all? Well, if you walk down any pharmacy aisle, you'll see tons of products. But despite all that, there's a ton of confusion out there and a real lack of clear scientific guidance for both patients and for us.
Let's start with something that seems basic but is clinically huge: vulva or vagina. You'll find patients use these words interchangeably all the time, and it's not just about being technically correct. It's a real clinical issue. You know, if a patient comes in complaining of vaginal itching, we absolutely have to clarify. Do they mean the external skin of the vulva, or is it something happening inside the vaginal canal? Because the diagnosis and the treatment for those two things are worlds apart.
And this is a big deal because the stakes are really high. Just look at this number. The research tells us that at least 75% of women across the globe will deal with a genital infection at some point. And you know what? A lot of these problems are directly influenced by hygiene habits.
And here's the real challenge for us in the medical community. Even though these conditions are incredibly common, there's a surprising shortage, a real lack of formal, evidence-based guidelines on intimate hygiene. That knowledge gap leaves us trying to navigate this really sensitive area without a solid clinical framework. And that's exactly what we're going to try and build today.
So to really understand good hygiene, we have to first appreciate the incredible biological system that we're dealing with. I want you to stop thinking about the vulvovaginal area as just skin and start thinking of it as this complex, self-regulating ecosystem. It's like an unseen guardian, constantly working.
This quote from The Little Prince is just perfect here, because the real story of vulvar health isn't about what you can see on the surface. It's all happening in this dynamic, microscopic world of interconnected systems, all working together to fight off infection and maintain balance.
The first line of defense is the physical one. We call it the epithelial shield. This isn't just one thing. It's a whole barrier system. You've got the keratinized cells of the skin itself, pubic hair, which helps with moisture, and then this really critical layer called the hydrolipid mantle. Think of it as this natural film of sebum and sweat that not only moisturizes the skin, but also helps keep it acidic, which brings us to our next line of defense.
Okay, going a little deeper, we find the microbiota. This is a whole community of resident bacteria. And the star players, the real heroes, are the lactobacillus species. And they're not just hanging out. They are actively defending their home. They produce things like lactic acid and hydrogen peroxide that make the environment really tough for any bad bacteria to grow in.
And all of this work culminates in what we call the acid mantle. That lactic acid that the lactobacilli are pumping out, it helps keep the skin's pH below 5 during the reproductive years. And this acidity is the key. It's the secret sauce. It creates the perfect home for all the good bacteria to flourish while stopping pathogens like Gardnerella or Candida in their tracks. It's a really beautiful, synergistic system.
Now, it's super important to remember that this whole protective system isn't static. It's not the same your whole life. It's driven by hormones, which means it changes in very predictable and very significant ways as a woman ages. Getting a handle on these changes is absolutely key to giving the right advice to our patients.
This table just lays it all out so clearly. Look at the pre-puberty and postmenopause columns. The skin is thinner, there are fewer of those protective lactobacilli, and the pH is higher, more neutral, around 6 or 7. Now compare that to the reproductive years. Estrogen makes the skin thicker, the good bacteria are thriving, and the pH drops to that protective acidic 4.5 to 5. This makes it so obvious why a one-size-fits-all approach to hygiene just doesn't make any sense.
So we have all this great physiology. How do we actually put it into practice? This is where evidence-based cleansing comes in. It's all about tailoring what we recommend based on the specific hormonal and microbiological state of the patient sitting right in front of us.
And that means we need to get specific. General advice isn't good enough. For a young girl who hasn't hit puberty, or a postmenopausal woman, their vulvar pH is more neutral, right? So a cleanser with a pH of 6.0 to 7.0 makes sense. But for a patient in her reproductive years, we should be recommending a more acidic cleanser, something with a pH between 4.5 and 5.0, to support her natural defenses.
Thankfully, we do have some great international guidelines that give us a solid checklist. They emphasize using a pH-balanced, hypoallergenic liquid wash. They tell us to avoid harsh things like regular bar soap or bubble baths. They are very clear that vaginal douching is not recommended. And they cover practical tips like wearing breathable cotton underwear and, of course, always cleansing from front to back to prevent contamination. Okay, so we've talked about the ideal situation. Now let's get into what happens when that delicate balance gets thrown off. We're going to look at some of the most common hygiene-related problems that bring patients into our clinics.
Vulvar contact dermatitis. You are going to see a ton of this. It's a huge complaint. And all it is really is an irritation or an allergic reaction on the vulvar skin that's caused by something it came into contact with. I mean, with prevalence rates hitting over 50% in specialized clinics, it's something every single one of us needs to have on our radar.
And a major source of this irritation, believe it or not, comes from the very products designed for feminine hygiene. I'm talking about douches, scented wipes, perfumed pads, and harsh soaps. They can be packed with fragrances, preservatives, and other chemicals that are powerful irritants, or, for some people, straight-up allergens.
Now, here's an ironic one. Sometimes, the very medications people are using to treat a problem can be the culprit. A patient might be using an over-the-counter anti-itch cream, but the preservatives in that cream are actually causing a contact dermatitis. It creates this frustrating cycle where the treatment is actually making the problem worse.
And it's not always a chemical we have to hunt for. We also have to ask about physical irritants. Things like tight synthetic clothing that traps moisture, scrubbing too hard with a washcloth, or using water that's way too hot, all of these can physically damage that sensitive skin barrier and disrupt the whole system.
I really want to focus for a moment on vaginal douching. It's still a really common practice. A lot of women believe it's a necessary part of being clean. But the overwhelming scientific consensus is that it does way more harm than good.
And this slide is so crucial because it shows the disconnect between what patients think is happening and what the science actually shows. They might be douching to feel clean or to get rid of a symptom, but the clinical evidence is crystal clear. It completely disrupts the protective vaginal flora. That disruption directly raises the risk for infections like bacterial vaginosis, and it's even linked to really serious issues like pelvic inflammatory disease and infertility.
So, this all brings us back to us, to our final and maybe the most important part of this whole discussion. As healthcare providers, our biggest role in this area is to educate our patients, to clear up these misconceptions, and to empower them with real scientific knowledge.
And that is really what it all comes down to. This is the goal. By taking these conversations out of the shadows and making them a routine part of our clinical practice, we can give women the scientific foundation they need to make good choices for themselves. Ultimately, our job is to empower them to be the advocates for their own intimate health for their entire lives.